ABC 7 News continues to track San Francisco's efforts to address the drug and mental health crisis in this city as part of the effort to build a better Bay Area. Is it improving? Well, ABC 7 News reporter Leanne Melendez went out with a team of professionals as they reach out to try to help the most challenging people on the streets. This has to be an incredibly difficult job.
Well, I learned that not everybody could do this job. It really is hard. And I also learned that in 2019, the city came up with something called Mental Health San Francisco. And the city basically told the health department, hey, show us ways to make things better for those with mental health issues and substance use disorders who also happen to be homeless. And every year, we want to report to see how things are going. So this is one of their case management programs, and it's tough.
We check for breathing, check for skin color, make sure that there's no overdose happening.
This is street health care in San Francisco.
So people experiencing serious mental illness, chronic and severe substance use.
Kathleen Silk is a health department clinician and the program manager of B.E.S.T, which stands for Bridge and Engagement Services Team.
Bringing services to the street is hard, but that is what's needed right now to get people engaged with ongoing care.
No familiar folks over here.
Outreach is what they do best, walking the streets and offering something in exchange for being heard.
Anybody in need of like a bag, right? So you guys talked to us before, right?
We face challenges around people being skeptical of receiving services.
They don't trust you.
That's right. Really being able to get on people's level, speak a common language, show a lot of empathy, resilience, recognition for where they were and how far they've come.
That seems like so much. How long? That must take a long time.
It does.
Christopher Wallace, a field supervisor, remembers one case in particular.
We had to go out consistently and spend time with her, get to know her.
How many times?
Oh, this person I can say easily 30 times.
Wow.
This is the information on the different programs you can go to.
Today, Wallace and his team have reached out to this group to offer them information on any kind of health services, like the ones offered at Maria X. Martinez Health Resources Center in the south of Market neighborhood. But as we stopped to talk to 22-year-old Torin Relia, it was obvious his drug use was keeping him unhoused.
More accessible out here, unfortunately.
What is more accessible?
My substance use, the things I participate in are more easy to get out here.
Right now, he's not ready to address his addiction.
I gotta take it day by day and finish this challenge first.
You yourself say how challenging this is, and it takes a long time. What's your success rate?
Our success rate has been pretty huge. We've engaged over 8,000 people since launching last March.
But just to clarify, engaging someone may be as simple as giving them information on services and nothing else.
You didn't engage with him because he is right now not engageable.
Engageable, he wouldn't be
because he
responsive.
just used drugs.
Correct. But in terms of your ability to kind of like reach them and discuss the services that we can provide to assist you, that's not going to get through that clear in the moment in most cases.
But in 1 year, the team says it has helped 175 people access mental health services, 130 substance use treatment, 526 have received medical services, and 277 have been placed in shelters.
I know your kids are proud of you. I know your family's proud of you. Everyone, all of us that we get to work with you are proud of you, man.
Deshaun Dixon is one of the success stories with the help of Luis Dorath, another peer counselor.
He said, bro, like, you know, there's people out here that care about you. There's people out here that, like, you know, that want to see you succeed. Like, don't think that, you know, like the whole world wants to keep you down. There's people that love you, bro.
Dixon is drug-free and in permanent supportive housing.
It's a testament to everyone in San Francisco that wants to see a change and wants to see, you know, be of service to others.
How many more people are you going to inspire?
So their annual budget, just to do what you saw there, is $6.2 million. And they are not, believe me, the only street team in San Francisco. There are other teams that operate differently, like the night navigation team, which just started last October, not even 6 months ago. They operate from 7 p.m. through 3 in the morning, and that's the one we want to follow next. And I mentioned 6.2 million because so many people come up to me and say, why do we spend so much money on the homeless? Well, we're giving you examples here. They're throwing a lot of money to this problem.
It's just so sad, though, to see people slumped over on the sidewalk, and that's our normal.
Yeah,
It's
that's why I say it's very hard to do this job.
I bet.
Yeah.
Thank you, Leanne.
Sure.